measure.
Mr. Chairman, I'd like to express my support for the bipartisan Improving Care in Rural America Reauthorization Act that I've introduced alongside my good friend, Senator Tim Scott. This legislation would reauthorize critical rural health care services outreach programs that increase access to health care services in rural communities. Rural residents often encounter barriers to accessing health care, including workforce shortages, distance and transportation issues, facility closures, and health insurance coverage. These roadblocks result in unmet health care needs, leading to a 43% higher mortality rate for rural Americans compared to those living in cities and suburbs. We must ensure that vitally important health services are able to reach people in rural communities, which is exactly what the Rural Health Care Services Outreach Programs does. In fiscal year 2023, the outreach program delivered direct services to more than 500,000 individuals in rural communities, many in areas with little to no other local health care infrastructure. The Rural Health Care Services Outreach Programs represent one of the federal government's most successful rural health grant programs. These programs fund locally driven, time-limited projects that focus on improving access to care, quality improvement, care coordination, and health outcomes in rural areas. In fact, several recipients in Georgia benefit from this program, including the Southern Healthcare Collaboration in Baxley and the Wellstar Health System in Marietta. The economic case for extending this program is also clear. The Rural Health Network Development Program grantees a long-generated $2 in local impact for every $1 of outreach funding in fiscal year 2023. By reauthorizing rural health services outreach programs, this bill will lead to increased access to health care services and preventative screenings, improved chronic disease management and health outcomes, expanded telehealth services, and reduced emergency department visits for the nearly 500,000 individuals who receive direct services for these programs annually. In 2020, President Trump signed into law legislation reauthorizing rural health outreach services programs under the 2020 CARES Act through fiscal year 2025. The Improving Care in Rural America Reauthorization Act of 2025 will extend these critical programs through 2030. Further, bill changes will ensure that local rural needs are prioritized in grant awards. I applaud Senator Scott for introducing this bill with me, and I urge my colleagues to support it. Thank you, Mr. Chairman, and I yield back the remainder of my time.